there's a lot of bicyclists, and I get to know a lot of them because I try to come over here and are quite a bit. We can go a little bit slower, right? Let's just take a minute. And then we...
He's got severe aortic stenosis, which is a narrowing of the heart valve, so blood can't get out of the heart. Blood backs up into the lungs, and patients become short of breath with exertion.
There's quite a difference in this man from what he was before.
We can restore his life, not only lengthen it, but we can restore it back to health. He's an avid cyclist who actually cycled clear across the United States.
We had to average 85 miles a day, and I was 68 at the time. They're going to replace my aortic valve. I'll be able to bike with man.
Well, actually, that's not going to be too hard.
You know what? When you ride that bike, you're a kid again, and what better thing to have when you're 84 years old.
30 years, not one fight.
Maybe we better start one. We've traveled the world together. We're just one. We're just simpatico. What more can I say? God gives you a chance sometimes, and if you grab it, you'll win.
Without him, won't be my life.
We're going to be replacing his old aortic valve with a new aortic valve without having to open up the chest. Now for Bob, this is great because he's already had open heart surgery once, and this just makes it so much easier for him. Do you have any questions for me?
No, I think we've talked a lot. I didn't want my chest opened again.
He thought he had no options to make his life better.
I didn't even know this was available until recently, and it hasn't been available.
Brand new. You all right? You ready?
Every patient that walks through our doors, you know, we really take that patient into our arms and just help them feel comfortable, them and their families.
If he chose not to have this procedure, the only thing he could look forward to was progressive shortness of breath, eventually being bedridden and dying of heart failure.
Love you. Okay, you're all right. It's gonna be okay. It's gonna be okay. Okay?
Today's procedure in terms of complexity is a 10 out of 10. It is the most complex procedure that I do. Extremely high risk. We have 16 people in the room, 6 doctors, 4 different specialties, all working together as a team to make sure we have a great outcome for Bob.
An 80-year-old enjoys waking up tomorrow just as much as a 10-year-old. Tomorrow is all we all have.
We take this new valve and we place it on a balloon. We crimp down so we can get through the patient's arteries in his groin.
Make a little incision right here and you can do a hand.
Pigtail going in.
What I do as an interventional cardiologist is I implant the valve itself.
Balloon's going in.
And inject, please. Balloon up. That is the patient's new aortic valve.
Every patient is important, but just knowing what their lifestyle was like before, what they hope to achieve by getting this procedure, it really hits home for me. So when we deployed that stent, I was internally cheering.
And we'll just take a quick pressure measurement. Patients are able to go home in 2 to 3 days, and they do as well as they would have with traditional open heart surgery. That's the best thing. Let's go talk to the family. Hello, how you doing? Everything went great.
It's okay.
Everything went great. He did really, really well. Patients are able to go back to biking or go back to walking normally. They can try to live for that next birthday or that next anniversary.
I was thinking about you the whole time while I was in there.
Thank you.
No problem, you did well.
Now I can cry. I'm just so happy.
Just the worry she must have felt every morning that, you know, you want your husband there when you wake up, your best friend, and so now she got him back. So I'm happy for Anita.
You have to take your honey out on a date, you know.
They got it. They got everything on it.
If he'd had open heart surgery, he would have been in the surgical intensive care unit for days on end, lots of rehabilitation afterwards. So this is remarkable. 11 times around is a mile.
I might take off here.
It'll be wonderful to see him coming around the corner.
All I had to do was step on the pedal. Back in the saddle again. How lucky can you get? This new procedure comes along just when I need it. I don't think I would have finished the year.
You look so good. You're just so fast. You look so good.
Maybe I dropped the ball. My hope is that we'll soon be able to hit the road and get a few little trips in.
I don't think it's going to be too long the way he's going. He's ready to go.
I'm back.
Love you, honey.
Great life.
Great life. Now we have more of it.
Now we have more of it.